Let's talk a bit about what the Labour Party have done today, which is a really interesting article in The Telegraph this morning, where Wes Streeting, the Health Secretary, has said that people could be, this is a plan for the future, so let's just be super clear about that, but could be given weight loss jabs to help them back to work. So he's connecting our obesity epidemic with our worklessness epidemic. And we've just been looking through some of the numbers. Let's go on the first one, which is the obesity epidemic. We reported just last week that we have never been fatter. The average middle-aged man now weighs 14 stone. A woman of the same age typically weighs 12 stone. And they've been rising, and they have risen by about 1 stone since the 1990s, so we're getting bigger. Obesity costs the NHS around £11 billion a year. Of course, it is linked to all sorts of terrible health conditions, heart disease, cancer, type 2 diabetes. And this was a remarkable number, Camilla, in the work that our production team and us have been doing this morning looking at this. 40% of the NHS budget is spent on preventable health conditions. That is possibly going to rise by 60% by 2040. So if we could tackle the obesity crisis, it would be a way of putting money into different preventative healthcare things in NHS rather than just demanding more taxes.
But I suppose the central question is obesity linked to worklessness? So the figure we have on that is that obesity causes people to take an extra 4 sick days a year on average, while many others are forced out of work altogether. I'm not sure necessarily when we look at those worklessness statistics whether we can determine how many of those people are overweight, or indeed, Kamal, whether being on a weight loss jab like Wegovy or taking Ozempic or any of the others is actually going to bring down that figure and get people off benefits. So whether the government has successfully made this link, I mean, I suppose it makes common sense that there could be people, A, taking more days off sick because they're obese, and B, out of work altogether because they're not fully mobile. Last month forecasts suggested that the number of workers on long-term sick leave would increase from 2.8 million by more than 50% in the next 5 years. So this sort of worklessness epidemic, we talked about an obesity epidemic, we're also talking about a worklessness epidemic, but are those two epidemics linked?
Yes, and the government is suggesting that it is, and they've announced this deal with Lilly, £280 million of investment. Lilly's one of the world's largest pharmaceutical businesses. Will look at different types of medicines in this sector. So it won't be Wegovy and it won't be Ozempic. So this trial is going to look at a new drug called tirzepatide, which is sold under the brand name Mounjaro. It's going to be used for weight loss and treatment of type 2 diabetes. And they're actually going to test it working with the NHS. One of the values of the way the NHS is constructed is called single-tier pricing. It means that you can test, obviously using the correct approaches, drugs very easily in the UK because we have a single health service. And It actually makes this type of project. Can we find ways of using the advantages that we have seen for so many millions of people around Ozempic and Wegovy? Can we see if we can solve the obesity problem? And clearly there is a link with worklessness. And how do those two things come together?
It's interesting that Streeting decided to announce this in an op-ed in The Telegraph, because I think our readership has grown increasingly fearful that there are too many people that could work who either can't work or won't work. And I mean, there's a kind of slightly right-leaning bent to what he's saying here, deals with pharmaceutical companies, which perhaps would usually set alarm bells ringing among the left, that he is saying that we have to tackle the obesity crisis. OK, we could associate perhaps the Labour government with nanny statism and interventionism, but I do think it's quite interesting, not least when there had been criticism of some people using these drugs basically to lose weight even some quite thin people losing weight at the expense of actual diabetes patients that were struggling to access this medication because suddenly there was this whole explosion of people suddenly taking weight loss jabs. But along with banning junk food adverts, which are targeted at kids, and trying to introduce preventative measures, we've had talk of more sugar and other taxes, haven't we? I mean, I sort of prefer the idea of actually putting people on a weight loss jab that could definitely mean that they could be losing weight than sort of dictating what people should be eating and selecting at the supermarket.
Clearly leaning into that argument that this may be down to health issues, it may be down to mental welfare issues, but is it also down to people just being lazy and life on benefits being easier than life in work? I think on those types of issues, Rachel Reeves has made it clear, and I think this will be one of the big battles for this government, that they are going to tackle worklessness and that benefits should not be unconditional. There should always be a route back to work. So that's about early intervention when people have left work. It's about making sure that work pays and incentivizing employers to keep people in work even when they have illness episodes. What tends to happen is people get signed off for long periods. They then get lost to the workforce and then they live in a workless household. And given the epidemic that we are facing, often in a workless street. And I remember in the 1990s when I first started in work and unemployment was seen as being high, but still only 2 million people out of work. In the 80s, it was 3 million. People in workless households, or the number of people who are not in work or looking for work, is now at 10 million. We should be writing about this as a headline number every day. And what has happened is that as soon as you become culturally used to being in a workless situation, it is much harder to get yourself back into work. So how do we incentivize employees to act? I came across as well a remarkable figure. I wrote about this a couple of weeks ago. Just before the COVID pandemic and the lockdowns, the number of people in work was at a record level and the number of people out of work was at a record low. So something has happened in COVID to create this crisis, which we have talked about before. People becoming used to being at home and being paid for. The one thing on Labour's side is, just like reform of the NHS, unlike the Conservatives, they've probably got more chance to get this right and help people back into work because work is good for you than maybe the Conservatives would have. But obviously, with George Osborne's comment, they were actually successful because before COVID, we had record number of people in work.
So what is the COVID effect? It could be that a lot of people are suffering from mental health problems that prevents them from working. It could be that because of the pressure on GP surgeries, that doctors are handing out sick notes with far too much prevalence and automatically signing people off sick rather than exploring a little deeper the issues that people are facing, be they mental or physical or both. It could be that COVID has created an environment where, I mean, those worklessness statistics also reflect people who retire early. So when it says you're of working age, I mean, I'm of working age now, I think, until I'm 68. If at 60, if I was a 60-year-old woman, COVID happened, I actually thought, do you know what? I've had my fill. I'm not going to go back. Maybe I'm going to volunteer at my local charity shop and help out with my grandchildren. That person will be added in the statistics. But one doesn't want to demonise and stigmatise. When we talk about people who can't work, but also people who won't work, there must be a tranche of people, and I know the left doesn't like to discuss it, who are choosing not to work as a lifestyle decision. Do you not think that?
I think that we have to help people be motivated to realise that if your job pays well and there is support, if you've got family or caring responsibilities, there is support for you. I think without criticizing groups of people for being lazy. I think a more positive conversation, and I feel a little more more optimistic conversation, is how do we motivate people that
I totally agree.
Why do we work hard, Camilla? We work hard because we enjoy what we do. We're passionate that journalism really matters. And very frankly, Camilla, it supports a lifestyle that is, very privileged. And so once you give people that stake, we wouldn't want to stop working. We do both work very hard. Our production team works very hard. And we are here with a vocation that we really believe in. How do we motivate more people to be really connected? It might be linked to this whole idea of, low status, low paid jobs, or at home with your children or caring responsibilities on a high enough number of benefits to keep yourself in food and keep the lights on to an extent and the heating on. Well, you can see why people might make that decision.
I totally agree with you. And I think for a lot of people, you were talking about workless households. And if an example has been set by parents who aren't working for whatever reason, that may in turn disincentivize younger people from going into the workplace because that is what they have become used to.
Absolutely.
It may well be, by the way, due to a lack of opportunity. But we also know at the other end of the scale that if you apply for the dole, you are meant to say to the dole office, I have spent 35 hours a week looking for work. But there is no way of policing that. So people can go in and say, yeah, I've spent 35 hours a week looking for work, but continuing to collect the dole. There's something isn't quite right here when we have got record numbers of vacancies, but also record numbers of people out of work. I appreciate the whole argument about there are some jobs that people just don't want to do. But at the same time, how can not working, if you can work, be preferable to working when you consider all of the other benefits, not just financial and giving people a sense of self-worth, and indeed I think work generally is confidence building. It's also interaction with our fellow men and women. That's another reason why we love this job, because we work in a newsroom and it's fun to collaborate with colleagues on this level. But I appreciate what you're saying about the stigmatisation. Maybe the previous Tory governments haven't dealt with this properly but I still think we are deluding ourselves if we're saying that everybody in those statistics is going out going, yeah, I've got to work and I want to work and I can't work. There will be some that just don't want to work.
Rachel Reeves would also be very glad of the tax revenues that people in work would bring in, given that the costs for worklessness are expected to rise by £30 billion. And that's as much as we spend on primary schools in England. So it shows that the costs to the government and the cost to all of us are very high.
But is the solution, I get the agreement with the pharmaceutical company, and that sounds very positive. And I think that the availability of these weight loss jabs, and I think that clearly these weight loss jabs are very effective. There's many case studies of people who are literally saying, I've lost 2 stone in 6 weeks, I'm managing to keep it off, and all the rest of it. Having said that, are there other ways of getting people to eat more healthily without being completely nanny state? We had a contribution by the famous doctor, Chris Van Tulleken, one of the medical twins. You'll be familiar with them. If you've got children, you'll know them from Operation Ouch. Anyway, Van Tulleken has written for The Telegraph saying, actually, let's just look at food labelling. And we've discussed this before. Do we actually know what we're eating? Does the traffic light system work? He's suggesting scrap the traffic light system, which for the uninitiated is where you look at a label on food. If it's red, it's bad. If it's amber, if it's yellow, it's okay-ish. And if it's green, it's better. And say, adopt a more European model, which is putting big black hexagon labels on food saying, this has got too much sugar, this has got too much saturated fat, this has got too much salt. And obviously he's made a name for himself railing against ultra-processed foods and saying that our diet is terrible and all the rest of it. It does strike me that there is a strange dichotomy here, that on one hand we've got concerns being raised about food bank usage, and on the other we've got concerns being raised about obesity disproportionately affecting the same socioeconomic group.
I'm sure Rachel Reeves would also like the tax revenue. If people are in work and paying taxes, that's much better for our public finances than if people are on benefits. Over the next 5 years, if we stay at this rate of worklessness, that will cost the Exchequer an extra £30 billion. And £30 billion is what we spend every year on primary schools. So it just shows that amongst all the discussion of taxes going up, of borrowing going up, how are we going to fix what Rachel Reeves describes as the black hole? If we could get a significant number of those people who are not working and not looking for work into work, that starts solving our huge economic problems.
Just one final thought, Kamal. Something strange is going on here because we have concerns about the increase in use of food banks on one hand, and then we've got concerns about people eating too much. And actually, those concerns are overrepresented in the same socio-economic group. So what's going on here? It's quite the dilemma for the government to solve without, by the way, alienating that group on either side.
That, Camilla, on what we eat and who eats what is a whole nother podcast, which we should return to.